I potty trained my not even 2-year-old in less than 3 days.
Okay, so if you watch that video that I stitched, she actually goes on to talk and doesn't really say anything super important. You actually have to go back to part 2 and watch that video, because in the first video, she really just talks about herself as a parent. That being said, I know exactly what method she's talking about. It's the 3-day method that's commonly outlined in this book. Why do I have this book? Because I bought it. When I started potty training a couple of years ago with my kid, even though I'm a board certified pediatrician, I was kind of at a loss for where to exactly start. And so I wanted to read. Easily a couple of days to weeks in, I realized that this book really didn't make sense with childhood development, childhood behavior, and honestly, it wasn't exactly productive in the way that we would want it to be for children. Let me explain. Asking a child to develop a skill like potty training, which is a huge lifelong skill, and ask them to do it in 3 days is a huge ask. I'm not saying it's not possible. As you can see, this parent did it, other parents have done it. I just want you to know that if it's not working out, there's a reason why. Honestly, potty training at 2 years or less and using this method makes your life unnecessarily hard, in my opinion. It also makes it unnecessarily difficult for this child. I will say she brings up an excellent point about not having any negative emotions, because it can end up shaming your child if they have an accident. She's totally right. There's other things that I think are a little bit more controversial. At 2 years of age, maybe your child has some cues, but sometimes not all child has cues. Also, she's saying that you should be looking at fun liquids, high fiber foods. But what happens when your child refuses those high fiber foods? Instead, I try to recommend introducing the potty in a gentle, non-threatening, very slow sort of way, even maybe 6 months before you broach potty training. So the potty isn't like this band-aid you rip off and it is like, okay, now you're gonna sit on here and do your pee and poop, because diapers were where you did it for the first 2 years of your life, and now we're just totally switching it up on you. Not to mention the fun liquids, the high fiber diet. It sounds great in theory, but not every parent wants to introduce juices to their child. For example, me. Then you might be stuck with another problem. She mentions not having a plan B. I see where the utility of this comes into play, but I do also realize that parents have things come up, and sometimes you need to pivot. For example, I was not going to broach nighttime potty training when I had a newborn in the house, because I knew my daughter would have regressions of daytime potty training. And I was right. And we ended up doing nighttime potty training almost a year and a half later. And that's okay. My job as a pediatrician is to tell you about what's normal, and this falls in the range of normal. So if you watch this video and feel daunted or feel like this might be the cure-all method, I just want you to be prepared that it's not always for everyone.